Hi.
Hello. My name is Paige. I'm a nurse practitioner.
Hi. Nice to meet you.
What's your name?
I'm Lauren.
Okay. Alrighty. I'm just gonna sit down here. So, like I said, I'm a nurse practitioner. Do you have any questions about that role or what that means?
No?
Okay. Let me just explain a little bit about myself. A nurse practitioner is a nurse with an advanced degree. We have some more formal training past our regular nursing degree. We can diagnose, prescribe, things like that. Do you have any questions?
No.
Okay. All right. So, can you tell me a little bit about yourself? Your name, age?
My name is Lauren. I am almost 24 years old.
Okay. Can you tell me your date of birth?
February 16th of 1995.
Okay. All right. And where do you reside?
I reside here in Rockton.
Okay. Alrighty. And where do you normally seek your health care at? Like the emergency room or a doctor's office?
Doctor's office.
Okay. Alright. Sounds good. And do you identify, what race do you identify with?
White.
Okay. Alright. And are you married, single, divorced?
I'm single.
Okay. Alright. Sounds good. And what is your job?
I am a real estate agent.
Okay. Alright. And have you done that your whole career?
About 3 years now.
Okay. Alright. So can you tell me a little bit about why you came into the office today?
I'm just here because I'm a new patient.
Okay. Wonderful. Wonderful. Do you have any specific health concerns that you'd like to talk about today?
No.
Okay. Alright. So we're just going to go over kind of your health history since this is your first exam here. I will ask a lot of questions, but this is pretty typical of a first appointment. It helps me get to know you and where we should focus your health care at. Okay? Does that sound all right to you?
Yep.
All right. Wonderful. Okay. Do you know when the last time you saw your doctor was prior to, or nurse practitioner or other healthcare provider?
Maybe like 6 months ago.
Okay. All right. Good. Good. Do you have any past chronic illnesses that you want me to know about?
No.
Okay. Alrighty. Alright. And so now we're going to talk about kind of health maintenance things, your immunizations. Do you know the last time you had a tetanus shot?
Gosh, yeah, I can't remember. Probably have to look at my chart.
Okay. And did you have a flu shot this year?
No.
Okay. Alright. Do you know the last time do you know if you completed your series of hepatitis B vaccines?
I believe so.
Okay. Do you believe that you are up to date on all of your other vaccines?
Yes.
Okay. Alright. Any recent exposure to any communicable diseases such as hepatitis B?
No.
Tuberculosis?
No.
Okay. Alright. So now we're going to talk about your allergies. Do you have any drug allergies?
No.
Okay. What about any allergies to any supplements or over-the-counter medications?
No.
Okay. Any seasonal allergies?
No.
Okay. Any environmental allergies?
No.
Okay. Any allergy that you can think of to penicillin or latex?
No.
All right, wonderful. Any hospitalizations that you've had?
No.
Any surgeries?
No.
Any invasive procedures?
Nope.
Okay. And what about any treatment in the emergency department?
Nope.
Okay, wonderful. All right. Have you ever been involved in any accidents?
No.
All right. Any major injuries?
No.
Okay.
I'm perfect.
Any harmful ingestion of any chemicals or anything maybe accidental?
I don't think so. No.
Okay. All right. Moving on here. Can you tell me about any medications that you might take? Whether these are over-the-counter, prescription medications. Do you take any medications?
Just birth control.
Okay. All right. Do you remember the name of the birth control that you take?
Sprintec.
Okay. And do you take that regularly?
Yes.
All right. And how long have you been taking it for?
About 5 or 6 years.
Okay, I should back up to regularly. Can you tell me, do you take it every day?
Every day.
Okay, all right. So some people see a chiropractor, do acupuncture, massage, traditional medicine, any homeopathic medication, imagery, prayer, or vitamin therapies. Do you use anything like that? Okay,
No.
all right. And have you ever had any children?
No.
Okay. Any miscarriages?
No.
Okay. All right. Now we're going to talk about your family history. Are all your grandparents still alive?
Yes.
Are your parents alive?
Yes.
Okay. What about your siblings?
Yes.
All right. Your aunts and your uncles?
Yes.
Okay. And you said you didn't have any children. And are you married? I think you...
No.
Okay. All right. All right. So now we're going to talk about your family history now that you said that they are all alive. Any allergies that you can think of in your family?
No, not that I can think of.
Okay. What about a history of asthma or arthritis?
Mm-mm.
High blood pressure?
No.
Okay. Heart disease?
No.
High blood pressure?
No.
Okay. History of a stroke in
No.
any family members? Okay. Any peripheral vascular diseases?
No.
Diabetes?
No.
Cancer?
No.
Cystic fibrosis?
No.
Okay. Any belly problems? Anything in the bowels that you can think of?
In myself or my family?
In your family?
No.
Okay. Gout?
I don't know what that is, so no.
Okay. Kidney disorders?
No.
Sickle cell?
No.
Thyroid disease?
No.
Blood disorders?
No.
Any visual problems that you know about, maybe that are genetic?
I don't think so.
Okay. Obesity?
No.
Any birth defects?
No.
Sudden infant death?
No.
Okay. Neurological problems such as seizures or emotional problems?
No.
Okay. Learning disabilities?
No.
Okay. Or any drug or alcohol abuse?
No.
Okay. All right. So now we're going to talk about your living situation. So who do you currently live with?
I live with my boyfriend.
Okay. All right. Can you tell me a little bit about that?
We just live together.
Okay. Do you feel safe?
Yeah.
Okay. All right. So I know you said that you were a realtor. Do you have any other past work history?
I used to work in retail before.
Okay. All right. In your job, have you ever been exposed to any violence?
No.
Okay. Do you feel safe in your work setting?
Yeah.
All right. How do you feel about you and your boyfriend's economic situation? Are you having any money worries?
No, I think we're okay.
Okay, that's good. Very good. Can you tell me about your education? Have you finished high school?
Yes.
Okay. Did you pursue anything further with college?
I went for a couple of years and
Okay.
then I stopped.
Okay. And I assume that to be a realtor required some training. Can you tell me about that?
Yes, I went to real estate school.
Oh, wonderful. Okay, very good. All right, so now we're going to talk about some of your lifestyle habits. Can you tell me about any alcohol that you drink?
I drink every now and then.
Okay,
Some wine.
all right. Can you tell me maybe how many times a week?
Maybe once or twice a week.
Okay, so once or twice a week wine. And can you tell me about how many glasses you drink?
Maybe about 2 or 3.
2 or 3 glasses 1 or 2 times a week? Okay. Any other alcohol that you can think of?
I mean, every now and then I'll drink something else, but that's pretty much it.
Okay, all right. Any tobacco use?
No.
Okay. Do you drink any caffeinated beverages such as coffees, teas, or sodas?
I drink coffee.
Okay. Is that a daily thing or more of a special occasion?
I usually drink 1 cup of coffee every morning.
1 cup of coffee every morning. Wonderful. Okay. All right. Any recreational drug use?
No.
Okay. All right. Moving on. Now we're going to talk about your sleep patterns. How many hours would you say on an average night you get of sleep?
Probably 7.
Okay. Any sleep disturbances,
No.
such as nightmares, night terrors, frequently waking up?
I wake up sometimes in the night.
Okay. Anything that disturbs your sleep pattern?
No, I don't think so. Maybe just my dog who sleeps in my bed.
Sure, that can always interfere, absolutely. All right, next we're going to talk about exercise. Do you belong to a gym?
Yes.
Okay. How many times a week would you say that you go?
2 to 3.
Okay. Any other exercise that you do beyond the gym?
When it's nice out, I'll go for walks or runs
Okay.
outside.
All right. How many times a week would you say?
I don't know, maybe 2 when it's nice out.
Okay, wonderful. All right, so can you kind of give me a typical daily pattern, from when you wake up to when you go to bed, just a brief summary.
I wake up,
Mm-hmm.
I start working at my home office, usually for a few hours. Then I either go to my office at my work location, or I go out on appointments. Then I come home, or I go to the gym. Then I eat dinner and do things around the house, and then I go to bed and do it again.
Okay, all right. So in the last 24 hours, can you tell me what you have eaten?
Starting from breakfast yesterday.
Correct, yes.
For breakfast yesterday, I had a half of a bagel and a cup of coffee.
Okay.
For lunch, I had leftover homemade pizza and an apple. And for dinner, I had this weird porridge that my boyfriend Max made.
Oh, very nice. Okay. And is this a pretty typical daily intake of yours?
Pretty much.
Okay, all right. How many times a week would you say that you eat at a restaurant?
Once or twice a week.
Okay, all right. Do you feel like your nutritional status is adequate, or do you have any concerns with your intake?
No, I think I eat okay.
Okay, all right, so no concerns. And then how much water would you say that you drink in a day, or if not water, other fluids, such as coffee, tea, juices, soda?
At least a few cups.
Of
Water. I typically just drink water.
Okay.
Coffee in the morning and then water.
Okay, I see you have a glass right there. When you say cups, do you mean that size?
Yeah, maybe about 4 or 5 of these.
Okay, all right, very good. All right, so now to talk about your stress in your life. Do you feel as though you have any major stresses in your life?
No, just the typical stress.
Okay. How do you feel as though your coping mechanisms are?
Fine.
Okay. And you have people to talk to if need be?
Yes.
Okay. Alrighty. So to talk about your exposure to violence, do you have any of your family or friends been witnessed or exposed to any violence?
Not that I know of.
And what about yourself?
No.
Okay. Do you feel pretty safe? Do you feel safe where you live?
Mm-hmm.
Do you feel safe at your workplace? Okay. When you're driving in your car, I know you probably drive a lot being a realtor, do you wear your seatbelt?
Yes.
Okay. When you're riding your bike, if you do you wear a helmet?
Sometimes.
Okay, alright. Do you have a functional smoke detector and carbon monoxide?
Yes.
Okay. Do you have any guns in your household?
No.
Okay, alright. And what about any knives?
No.
No knives?
Just kitchen knives.
Okay, alright. Are those kept up?
Yeah. In
Okay.
drawer.
Okay, alright. So any current or past exposure to any secondhand smoke?
No.
Any lead exposure that you're aware of?
No.
Any radon exposure?
No.
Okay. And I believe any exposure to crime?
No.
Violence?
No.
Okay. And how do you get your drinking water? I know you said you drink a few cups of water a day?
I have a water filtration system in my fridge.
Oh, okay, wonderful. All right. Are you a part of any religious affiliation in particular?
No, I don't regularly go to church.
Okay, all right. Any ethnic or cultural beliefs or traditions that influence your health?
No.
Okay, all right. So now we're going to talk about your specific health history. Kind of go over some general things first, and then get a little more specific from there. Is that okay with you? All right. Any history of fever,
No.
chills,
No.
overall just not feeling so well?
No.
Okay. Fatigue,
No, not really.
night sweats?
No.
Okay. And any recent weight change?
Nope.
Okay. All right. And how often do you look at your skin, so examining for moles and other abnormalities?
Pretty frequently.
Okay. Do you have, can you give me a time? Weekly, daily, monthly?
Maybe weekly or monthly.
Okay. All right. Have you noticed any skin changes when you are looking at your skin? Okay. Any changes in your nails?
No.
Okay. Any recent changes in your hair, such as hair loss, change in texture?
I don't think so.
Okay, all right. And back to your skin, any itching or rashes, anything such as that?
No.
Okay. And to your hair, any changes in your scalp?
No.
Okay. Any changes in the distribution of hair on your head or on your body?
No.
Okay, all right. Do you wear any glasses?
No.
Okay. Do you know when the last time you might have had an eye exam was?
Quite a few years ago.
Okay. Any visual disturbances, so such as seeing any halos, wandering of your eyes, a lazy eye?
No.
Okay. Are you aware of any glaucoma, cataracts?
No.
Okay. And any eye infections?
No.
Okay. All right. So to your ears, any loss in hearing that you have noticed?
No.
Any pain in your ears?
No.
Any discharge or anything strange coming out of your ears?
No.
Okay. Any ringing in your ears?
No, just the normal.
Can you explain that a little further?
You know, everyone's ears ring, I'd say once every, once in a while.
Okay. Anything that is disturbing you?
No.
Okay. And I'll use the term vertigo, but it is in relation to the ears. Are you having any spinning sensations? Any loss of balance? Okay.
No.
Do you use hearing aids?
No.
Okay. So on to your nose and your sinuses. Any sinus pain or recent sinus infections?
No.
Okay. Any frequent colds or frequent blowing of your nose, dripping of your nose?
No.
Okay. Any nosebleeds that don't stop or happen very frequently?
No.
Okay. All right. Do you know when the last time you saw the dentist was?
Probably like 3 or 4 months ago.
Okay. All right. Do you have any missing teeth or any implants in your mouth, dentures?
No.
Okay. Any bleeding of your gums?
No.
Okay. Can you tell me about your oral hygiene, about your brushing, flossing, how many times a day? And
I brush my teeth 2 to 3 times a day,
okay.
and I floss typically once a day.
Okay. Very good. Very good. Have you noticed any lesions in your mouth?
No.
Okay. Strep throat?
No.
Sore throat?
No.
Any difficulty swallowing?
No.
Any voice changes or hoarseness?
No.
Okay. All right, on to your neck. Have you noticed any neck stiffness?
No.
Any decreased range of motion when you're moving your head around? Do you feel as though you can move your head in all directions comfortably without pain?
Yeah.
Okay. Any swelling that you've noticed in your neck?
No.
Okay. Any lumps or tenderness in your neck?
No.
In any of your glands? Okay. All right. So kind of just moving down the body, we're going to talk about your underarms and your breasts. Any swelling in the glands underneath your arms that you've noticed, maybe when you're shaving or washing?
No.
Okay. All right. Have you noticed any lumps or soreness in your breasts?
No.
Okay. Any discharge from your breasts?
No.
Okay. All right. And do you complete self-breast exams?
Yeah.
How often?
Oh, maybe once a week.
Once a week. Wonderful. Okay. And you said no children, so we can skip any breastfeeding questions. Okay. And have you ever had a mammogram for any reason?
No.
Okay. All right. Onto your chest and your lungs. Any cough that lasted an extended, more than a day or so? Okay. Are you coughing up anything?
No.
Okay. Any shortness of breath?
No.
At rest or with movement? Okay. Any wheezing?
No.
Any history of asthma?
No.
Okay. Any history of pneumonia or bronchitis
No.
or emphysema? Okay. All right. Moving on to your heart. Any heart problems? So this could include hypertension, chest pain, heart murmurs.
No.
Okay. Ever been told you've had rheumatic fever?
No.
Okay. Any exercise intolerance?
No.
Okay. Any chest pain or palpitations?
No.
Okay. Any swelling in your legs, arms, face, belly area?
No.
Okay. And have you had any of your cholesterol levels checked?
No, I have not.
Okay. All right. Moving on to your belly area. Do you have any food intolerances?
No.
Okay. Or any nausea or vomiting?
No.
Okay. Any difficulty with diarrhea or constipation?
No.
Okay. Can you tell me a little bit about your bowel patterns if you're having any difficulties straining or any rectal bleeding?
No.
Okay. Do you remember when the last time you had a bowel movement was?
This morning.
Okay. Any abnormalities with that, such as loose bowels, blood in your stool?
No.
Okay. All right. Have you noticed any swelling in the glands of your groin?
No.
Okay. Any history of a peptic ulcer?
No.
Gallbladder disease?
No.
Okay. And I know this might sound a little strange, but any occurrence of incontinence, I know you're young, but it can happen at any age. So, going pee a little bit in your pants or poop.
Oh, no.
Okay. All right. So now on to the urinary system. Any pain when you're going pee or bloody urine?
No.
Okay. Do you feel as though you have any frequency?
How frequent patterns and going to the
do you feel
bathroom?
like after you leave the bathroom you have to immediately go back there to urinate?
No.
Or shortly after? Okay. All right. Any problems with having to get up frequently to go to the bathroom during the nighttime?
No.
Okay. All right. Any pain in your back?
No.
Lower back area or front of your belly? Okay. Any history of any sexually transmitted diseases or urinary tract infections?
No.
Okay. Any urinary discharge?
No.
Okay. All right. Now we're going to talk about your reproductive health. Because sexual practices can put people at risk for diseases, I do ask all patients these questions. So do you remember when your last menstrual period was?
About 2 weeks ago.
Okay. And do your cycles flow, would you say, in a 28-day pattern, or do they differ from that?
Usually like a 30-day.
30-day? Okay. When you do have your period, is the flow excessive?
No, it's pretty moderate
Okay.
to light.
All right. Any cramping or premenstrual symptoms?
No, not really, just a little cramping.
Okay. Do you remember when you first got your period?
13.
13. Okay. All right. Good memory. All right. You said no births. So you said you were taking birth control, and that was Sprintec, correct?
Yes.
All right. Are you happy with that pill, or do you feel as though you need any more education about other options?
No, I'm happy with that pill.
Okay. Do you know when your last pap smear was?
It was last February.
Okay. And have you ever had an abnormal pap smear?
No.
Okay. Very good. Very good. Okay. Alrighty. And your sexual activity, is it men, women, or both?
Men.
Okay. So if you don't mind me asking, your number of current partners and then lifetime partners, throughout your whole sexual history.
One current partner.
Okay.
2 lifetime partners.
Okay. All right. And use of condoms?
No, not right now.
Okay, and I know you said that you were on birth control. Let's see here. Do you feel as though you need some more information on preventing sexually transmitted diseases?
No,
anything?
I've been in a relationship for a long time. I think
Okay.
I'm okay.
Do you have any concerns with your sexual activity? Is there any pain with sex before or after? Okay, all right. All right, now on to your musculoskeletal system. So any pain or stiffness in your joints or in your back. This could be throughout the day or when you first wake up.
No.
Okay. Any limitations in your range of motion? So moving your arms around, your legs around, anything that you've noticed there that has become limited?
No.
Okay. Do you feel as though you have any difficulties walking?
No.
Okay. Any swelling or weakness?
No.
Okay. All right. Any history of head injuries such as concussions or things like that?
No.
Okay. Any loss of consciousness?
No.
Okay. Any changes in your coordination?
No.
Okay. Dizziness?
No.
Numbness?
No.
Slurred speech?
No.
Tingling?
No.
Seizures?
No.
Any tremors in your body?
No.
Okay. Headaches?
No.
Okay. Any impaired cognitive functioning? So any problems with your memory, thinking clearly?
No.
Okay. Any irritability or mood swings?
No.
Okay. All right. Any history of anemia that you've ever been told by a healthcare provider?
No.
All right. What about sickle cell trait?
No.
Okay. Any bleeding tendencies?
No.
And do you know if you've ever had a blood transfusion?
No, I have not.
Okay. Ever been told you have a thyroid problem?
No.
Okay. Any unusual sensitivities to hot or cold?
No.
Okay. Any frequently going to the bathroom, or drinking a lot, or feeling as though that you really need to take a drink of something?
No.
Okay. Alrighty, and that will be all for the health history. I will give you a gown and you can go and I'll step out, you can change into it, and then we'll complete the next part of the exam. Do you have any other questions or concerns for me today before we begin the exam?
No.
Okay, alright, I will step out then.